First, the surgeon makes a main incision of about 2 millimeters at the junction between the cornea and sclera. The intraocular lens will be inserted through this incision. Then 1 or 2 additional microincisions are made to enable the manipulation with surgical instruments. Next, the surgeon applies a jelly-like transparent substance. This substance protects the internal structures of the eye and creates space for the surgeon to manipulate with the surgical tools. Using an ultrasound probe, the cloudy lens is broken down and gently removed via suction, leaving a clear capsular bag. Finally, the clear artificial lens is implanted using an injector. The intraocular lens unfolds gently into the capsular bag, replacing the removed natural lens. The incisions are self-sealing.